Have you ever wondered what it would be like to have a body that turns to bone? This is just one of the many bizarre medical conditions that exist in our world today. In this video, we're diving deep into the realm of the unusual and the extraordinary, exploring some of the most bizarre medical conditions that challenge our understanding of the human body. One condition that stands out is Fibrodysplasia Ossificans Progressiva, or FOP. Imagine a life where your muscles and connective tissues gradually transform into bone, limiting your movement and altering your physical capabilities. In this video, we'll uncover the science behind FOP, its symptoms, and the impact it has on those who live with it. You'll learn about the genetic mutations that cause this rare condition and the ongoing research aimed at finding effective treatments. Understanding rare medical conditions like FOP is crucial, not just for medical professionals, but for all of us. These conditions can profoundly affect individuals and their families, often leading to isolation and misunderstanding. By shedding light on these bizarre ailments, we can foster empathy and awareness, paving the way for better support and resources for those affected. So stick around as we unravel the mysteries of the human body and explore the fascinating world of bizarre medical conditions. Symptoms of FOP. Fibrodysplasia Ossificans Progressiva, or FOP, is a rare and debilitating condition characterized by the gradual transformation of soft tissues into bone. This process, known as heterotopic ossification, leads to the formation of extra bone in areas where it shouldn't be, such as muscles, tendons, and ligaments. As a result, individuals with FOP experience a range of symptoms that can significantly impact their daily lives. One of the most distressing symptoms is the limitation in mobility. As the condition progresses, patients may find it increasingly difficult to move their joints, leading to stiffness and a reduced range of motion. This can make simple tasks, like walking or even sitting, incredibly challenging. Alongside mobility issues, many patients also endure chronic pain, which can vary in intensity and often becomes a constant companion in their lives. FOP is an exceptionally rare condition, affecting approximately 1 in 2 million people worldwide. This rarity means that many healthcare professionals may not be familiar with the symptoms or the complexities of the condition, leading to misdiagnosis or delayed treatment. Understanding the symptoms of FOP is crucial for raising awareness and fostering empathy for those affected. By shedding light on this extraordinary condition, we can help create a more informed community that supports individuals living with FOP and advocates for further research and resources. Impact and prevalence. Fibrodysplasia Ossificans Progressiva, FOP, is an incredibly rare condition, with an estimated prevalence of about 1 in 2 million people globally. Each year, only a handful of new cases are diagnosed, typically ranging from 1 to 5 new cases annually in the United States. This rarity makes FOP one of the most uncommon genetic disorders, leading to significant challenges for those affected and their families. The global distribution of FOP is not limited to any specific region or ethnicity, which means that individuals from diverse backgrounds can be impacted. However, due to its rarity, many healthcare providers may not recognize the symptoms or understand the complexities of the condition, resulting in misdiagnosis or delayed treatment. This lack of awareness can exacerbate the challenges faced by patients, who often struggle to find appropriate care and support. Living with FOP presents numerous difficulties, including severe limitations in mobility and chronic pain. As the condition progresses, individuals may experience a gradual loss of function, which can lead to isolation and emotional distress. The unpredictability of flare-ups and the potential for rapid progression of symptoms add to the anxiety faced by patients and their families. Raising awareness about FOP is essential not only for improving diagnosis and treatment, but also for fostering a supportive community that understands the unique challenges faced by those living with this extraordinary condition. Fatality rate and prognosis. Fibrodysplasia Ossificans Progressiva, FOP, is a condition that significantly impacts the lives of those diagnosed. But it is important to note that the fatality rate associated with FOP is relatively low. Most individuals with FOP can expect to live into their 40s or 50s, although life expectancy can vary based on the severity of the condition and the complications that arise. Complications from FOP can be severe and may include respiratory issues, particularly as the extra bone formation restricts chest movement and lung capacity. Additionally, patients may face challenges related to mobility, leading to an increased risk of falls and subsequent injuries. These complications can contribute to a decline in overall health and quality of life, making ongoing medical care essential. The emotional and psychological impact of FOP on patients and their families cannot be overstated. Living with a progressive and debilitating condition can lead to feelings of isolation, anxiety, and depression. Patients often grapple with the uncertainty of their future, as the unpredictable nature of flare-ups can disrupt daily life and plans. Families, too, experience emotional strain as they navigate the challenges of caregiving and the fear of potential complications. Understanding the prognosis and the associated challenges of FOP is crucial for fostering empathy and support for those affected, as well as for advocating for further research and resources to improve their quality of life. Treatment and cure options. Currently, there is no cure for Fibrodysplasia Ossificans Progressiva, FOP, which presents a significant challenge for those affected by this rare condition. The focus of treatment is primarily on managing symptoms and improving the quality of life for patients. This often involves a multidisciplinary approach, including physical therapy, pain management, and supportive care to help maintain mobility and function for as long as possible. Management strategies may include the use of anti-inflammatory medications to alleviate pain and reduce swelling during flare-ups. Physical therapy can play a crucial role in maintaining joint flexibility and muscle strength, although it must be approached with caution to avoid triggering further ossification. Occupational therapy may also be beneficial, helping patients adapt their daily activities and environments to accommodate their changing physical abilities. In addition to these management strategies, ongoing research efforts are dedicated to finding effective treatments for FOP. Scientists are exploring various avenues, including gene therapy and targeted medications that could potentially halt or slow the progression of the condition. Clinical trials are being conducted to assess the safety and efficacy of new therapies, offering hope for future advancements in treatment options. While the journey for individuals with FOP can be challenging, the commitment to research and the development of management strategies provide a glimmer of hope. By raising awareness and supporting ongoing studies, we can work towards better outcomes for those living with this extraordinary condition. Fibrodysplasia Ossificans Progressiva, FOP. In this video, we've explored the complex and fascinating world of Fibrodysplasia Ossificans Progressiva, FOP. We discussed the key symptoms associated with this rare condition, including the gradual transformation of soft tissues into bone, which leads to significant limitations in mobility and chronic pain. The impact of FOP extends beyond physical challenges, affecting emotional well-being and quality of life for both patients and their families. We also highlighted the current state of treatment options, emphasizing that while there is no cure for FOP, management strategies such as physical therapy and pain relief can help improve daily living. Ongoing research efforts are crucial in the quest for effective treatments, offering hope for those affected by this extraordinary condition. It's essential to remember the importance of raising awareness for rare conditions like FOP. Increased understanding can lead to better support, improved diagnosis, and ultimately, a more compassionate community for those living with these challenges. If you found this information valuable, we encourage you to subscribe to our channel, like this video, and share it with others. By spreading awareness, we can help foster a greater understanding of FOP and other rare medical conditions. Thank you for joining us on this journey, and we look forward to bringing you more insightful content in the future.